So the first thing to say is welcome everybody. We have a very interesting event over the next 2 hours. I'm Diane Beddoes and my role is to moderate this process. I'm going to speak as little as I possibly can so that there is maximum opportunity for the presenters and respondents and those people who are raising questions in the chat have an opportunity to have their views heard and pose their questions. We are answering 2 questions today. The first is, what role has public debate played in COVID-19? What have we learned? So what's worked well and what's worked less well? And the second question is, how prepared are we for future health crises, public health crises? How should or does public debate feature in the governance of future health challenges? So what have we learned and how do we make sure that the next time we're hit with a crisis, we are better able to respond and public debate plays a role in that response? I'm going to introduce Ritva Halila, who is chair of the Committee on Bioethics at the Council of Europe, who is going to give us a bit more background. Ritva.
Thank you very much, and welcome. I also wish to welcome all of you to this webinar organized by the Committee on Bioethics of the Council of Europe. DHBio is a multidisciplinary committee composed of healthcare professionals, lawyers, ethicists, scientists, and politicians, among others, working together for strengthening the rights of patients in healthcare. The committee, or its predecessor, wrote the Oviedo Convention, the first and the only binding document in the field of bioethics. In its 28th article, the committee urges the member states to raise public discussion about bioethical issues concerning the development of biology and medicine. The DHBio has recently published a guide on public discussion, what it is, why it is important, and in what different ways public discussion can be promoted. Many Council of Europe member states have participated in this work and shared their experiences in raising public discussion on ethical issues in medicine, and these have now been collected to this guide. Now the COVID-19 pandemic has surprised the whole world and caused not only a lot of disease burden, but also economical suffering both in individual and society level. The restrictions have stopped traveling, caused business failures, and in unemployment, and thus have led families and individuals into poverty traps. We all have been forced to change our everyday habits, wash hands, work distant, and keep distances also with our closest ones, especially with elderly, and communicate through pads and phones. The DHBio wants also to take its share in this topic. While the global pandemic came unexpectedly, we were not prepared to prevent it. There are no specific medicines, but vaccines have been brought into market to prevent the disease. Relief and more normal life can already be seen ahead of us. Now it's time to collect experiences from different member states to learn from the past and to prepare better for the future. This webinar invites us to better understand and appreciate the importance of public dialogue, especially during a pandemic. This webinar also reflects on how authorities and decision makers can listen, learn from, and respond to the expectations of the public within a framework of public debate that promotes public trust. We explore here also tools available to engage and empower different individuals and groups in societies to better understand and comply with public health measures. We hear views from different disciplines and perspectives and different parts of Europe. I do hope that this promotes thoughts and gives tools for tomorrow, while this pandemic is not the first in its kind and certainly not the last. Thank you.
Thank you very much, Ritva. So I'm just going to take you through the format for the next couple of hours. We had 3 speakers today, and we have 4 respondents. So our speakers are Espen Nakstad, who is a physician, lawyer and author, and current Assistant Director of the Norwegian Directorate for Health and Social Affairs. We have Claudia Schwalitz, sorry, I hope I'm saying that correctly, Claudia, who is an author and expert on democratic innovation and deliberative democracy, and is currently leading work on innovative citizen participation and exploring questions about the future of democracy at the OECD's Open Government Unit, and has recently been writing about online engagement. So that might be something that it's useful to hear from Claudia about. And we also have Joachim Rockloff, who is an epidemiologist and a modeler and a professor at the Department of Public Health and Clinical Medicine at Umeå University. Then we also have 4 respondents. We have Nikabak Soliani, who is from the Advisory Council on Youth at the Council of Europe. We have Miguel Cabral from the Conference of INGOs at the Council of Europe. We have Pierre Malia, who is the representative of Malta to the Committee on Bioethics, and we have Assunta Moresi, who is the representative of Italy to the Council on Bioethics. The format basically is each speaker will speak for no more than 15 minutes, addressing those 2 questions that I outlined at the start. Then there will be a brief opportunity for questions from one of the respondents, and I will maybe ask a question as well. The chat function is going to be live throughout, so speakers and respondents, if you keep having a quick look at the chat, please do answer any questions that come up that are directed specifically at you, or any thoughts you have on other questions. Please do respond. Don't be too overly formal. We are going to try and answer as many questions as we possibly can, but obviously we're not going to be able to answer all of them. So what I will do is ask you to keep your questions as succinct as you possibly can, and to keep your responses succinct as well. And we are recording the event so that people who aren't able to join us live can watch it afterwards. So I'm going to introduce our first speaker, who is Espen Nakstad, who is talking about COVID-19 and public debate in Norway. Over to you, Espen.
Thank you very much. It's good to see you all. My name is Espen. I had a very nice introduction, so that's fairly correct. I'll try to shed some light on how this pandemic has been discussed through different stages really in Norway, and I think it goes, at least the pace of the pandemic is very similar all over Europe. So I think it's you will realize that you have discussed many of the same things in the public also nationwide. I tried to touch on the role of public debate and what went well, what went not so well, and say a bit about future challenges. It's at least now the challenges we're facing right now in March and April, which I believe are probably the toughest in this pandemic, because we have not a lot of vaccinated people yet, and still we have new virus mutations that pose huge strains on our ability to cope with this pandemic. So I'll get back to that also. But first of all, now it's exactly 12 months now since we were hit by the first wave of this coronavirus in Norway, and that goes for most of Europe. In our case, it came with thousands of Norwegians who had visited Italy and Austria during their skiing holidays. And they all came back this week, actually, and started spreading the virus without really realizing it. But in February, there was very little public debate on this in Norway. There was a sense of uncertainty. People didn't really know what to expect. And reports were coming in from northern Italy and still, of course, from China to a large extent. But then in March, tables really started to turn. The first thing that happened in our country was that some of the really large sport events were cancelled. And these were events, in our case, skiing competitions and arena events that normally gather hundreds of thousands of people in early March, and they were all cancelled. And that actually triggered a debate on whether this was really proportional and was it necessary. Then, very few days later, we also had a public debate in the media on the severity of this disease. Was it really just like a flu, or was it more severe? And we had daily reports from Italian hospitals. We also had webinars organized by the national health authorities that included Italian doctors and Norwegian doctors and other parts of the health sector. And this was sort of highlighted and discussed early in March. And I think people very soon realized that this was not a seasonal flu. This was more severe. At this time point, Norway was top 10 in the world of registered cases per capita for coronavirus. We were one of the first countries actually in Europe, after Italy and to some extent after Spain, that were hit quite hard. And the fact that we could not really trace the virus in March also triggered a debate about the response. Parents started taking their children out of school. This was also debated. So when the government decided to really hammer down this virus through a nationwide lockdown on the 12th of March, it was very much supported by the public. It was not really debated at all. Everyone was expecting it, and the mentality in the German population was that this was the right thing to do right now, and it was not criticized at all. Then, of course, when this happened on the 12th of March, this triggered an enormous need for information. And our crisis management strategy was to be honest and transparent to the extent possible. So we, as national health authorities, we answered all kinds of questions in the media 24/7. I mean, all kinds of questions, no question too silly or too serious. We answered all. And we also participated in all public debates at this time point, also with opponents. And we try to use these opportunities to share facts and thoughts and our analysis, and to be open about them for everyone to understand how we were thinking when we tried to steer this pandemic. And I think this was extremely important because we realized that we needed everyone to see the situation as we saw it, to the extent possible, of course. And we all needed to make sacrifices to avoid illness and death among the elderly, and for the health sector to function well. But also, we argued that it was important also to keep schools and universities open and running, that we had a low level of COVID-19 in Norway. So this was a lot of information sharing, not so much debate in the early months, but still things were starting to be debated more. And just before I go into what was actually the main topics of debate, I will just mention that all the documents regarding the crisis management were made public to journalists and also to private citizens. So they could all go on the official websites to the government and to the national health authorities and read everything. And of course, there are thousands of pages, but it's all there. So we had a very transparent strategy to make everything available, all our analysis, all our reports, everything that was made use of by the government for decision making. And we also tried to argue against conspiracy theories with facts, not to patronize too much, but to focus on the facts and evidence-based medicine to the extent possible. So the main topics that were discussed and subject to public debate were first of all, already in March, April, was the role of children in the spread of the coronavirus. Was it really necessary to close schools during March, during the lockdown? It was a debate, at least in April and May, when the schools reopened. But I think the general feeling and the sort of end result of that discussion was that the lockdown really contributed significantly to reduced mobility and to very limited contact person to person. Although in the situation with the traditional virus strains, small children, of course, played a very modest role in virus transmission. That has changed now, and now we have a new debate on that, because now we see more virus transmission in schools, in kindergarten, at universities. So now this is being debated again, or at least the debate is starting. Second thing that was heavily discussed was the quarantine regulations after border crossing. Since March 2020, no one has actually been able to enter Sweden to their private properties or their cottages or whatever they have in Sweden and come back without a mandatory 10-day quarantine. So this has been heavily debated. And here we also had legal debates. Were these restrictions in violation of our basic rights under our national constitution? We had these debates. We had lawyers and professors of law debating this with the health authorities, if this is really legal. And it's also been a court case, actually, where owners of cottages in Sweden have taken this to court to clarify if the Norwegian state actually can impose a 10-day mandatory quarantine after a holiday, for instance, in Sweden. Another thing that has been heavily debated is the use of face masks in public places. And it was debated in the spring of 2020 because we did not advise on that, because we had such low numbers in May, June, July. So after this lockdown in a year ago, we had hardly any patients in hospitals during summer. In July, we had 3 patients in Norwegian hospitals only. And in that situation, the math did not really support using face masks in the public. But as the figures started to rise in October, November, we advised people to use masks in public places. So this has now been a general advice for half a year. So to go into a bit more what did not work so well, at least local and regional lockdowns have been heavily debated in Norway recently, because our philosophy now is that wherever there is a rise of virus transmission, it's the local measures that count, not nationwide lockdowns. So we still have had only one nationwide lockdown, but we have strict restrictions in communities, in cities, whenever the figures rise. And despite this, like in Oslo now, shops are closed, for instance, now for 2 weeks, and there are quite strict restrictions. Schools are still open, but you can't do much more than go to school or stay in your home office. Everything else is closed, basically. And this is, of course, a heavy burden on people, but still more than 80% of the public supports the health authorities and these restrictions. So, but there is a clear tendency that younger people oppose them more. And we see that now after 1 year, that younger people, students, youth, they are more skeptical to these restrictions than the elderly. And people aged 50 or 60 tend to favor more strict restrictions still, because they are not yet vaccinated. So anyhow, in retrospect, I think the public debates we've had have been very useful. The debates have taken place in the media, of course, in radio, in TV. I think I debated last year 50 times on television with different opponents, people who argued that what we did was not the right thing to do. And there have been a lot of discussion points. I only mentioned 3 or 4 now in this short talk. But I think this public debate has been useful, at least that's our experience in Norway, because it provides facts to the people. And I think transparency really strengthens trust in authorities. Once people start noticing that you are hiding something or not really playing with open cards, they will not necessarily follow these strict restrictions anymore. That's our feeling, at least. A few words about preparedness for future crises. And I think this is really interesting, but it's really, really difficult to discuss, because the dynamics of a pandemic is very challenging. It's really hard to foresee the development weeks or months ahead. Right now, we are discussing a strategy on how to reopen society when the pace of vaccination increases and we get into summer. When can we open or lift all these restrictions in a planned manner? That's a key point to discuss right now. But still, it's very hard, because 1 week ago, the figures are quite good. Today, we have rocket high figures in many cities again. So it's really hard to foresee the development of a pandemic. I think it's really interesting now when we have a forum like this to discuss that things have been done quite differently in different countries in Europe. And the different waves of this pandemic have shifted. In Eastern Europe, Eastern Europe was not really hard hit by first wave. In the Nordic countries, we suffered, like in Central Europe, from a quite tough first wave in March and April. And then the second wave was very modest in Norway in October, November, December. But still, we have countries like the UK who have had nationwide lockdowns maybe 4 times. So it's a very different pattern in Europe, and that's also makes it difficult to foresee how to do things in the future. I think finger pointing has not been useful in any country. I think it's wise to think globally and to discuss not only national aspects, but also European aspects and global aspects of this pandemic. We are all in this together, so I think that's an important part of the discussion. We have had discussions on vaccine strategies and how to provide or when to provide more vaccines to non-European states, of course, like you all have discussed, I guess. That's also been a central debate. I think I'm running out of time, but just to finish, I think my key message is that to share information and to discuss openly and in a transparent manner is really important if you want the public to follow regulations and advice. Just on the final note, this communication needs to be in all relevant languages, of course. I think we have translated our information and also have dialogue in more than 100 languages to minority populations. And that's also important because we see in Europe that in all the bigger cities, the figures have been quite high, and it's hard to cope if you can't reach people with information in their native language. So that's also a thing to remember. So I think I'll leave it there after 15 minutes, and I'll be here for the next 2 hours to discuss it if needed. Thank you.
Thank you very much, Espen. That was a rich presentation with a lot of information in it. I'm going to invite Pierre to put a question to Espen.
Thank you, Diane. Well, thank you, Espen, for your interesting talk, especially about Norway. So I have a comment and followed by a question, because in Malta as well, we had in the beginning very good televised daily communication from the Director of Public Health and the Minister of Health, and this was appreciated a lot by the public. Of course, it was less appreciated when the communication was not done daily and it went down to twice weekly or even less sometimes, especially because at that time, concerns were coming in through the media, doctors descending about the vaccination that was being developed, etc. Now, the public, of course, did appreciate in the beginning as you said, the utilitarian measures that governments do actually introduce. Of course, for example, the public in Malta were a bit frustrated from what one sees, that the Director of Public Health actually said in the beginning that it could be prevented in Malta, since we were an island in the Mediterranean, but the airports were not actually shut down immediately and therefore none. So people do appreciate these kind of utilitarian measures. Of course, there is a limit to the time that you can do there. So my question would be that, of course, a public debate in the beginning is certainly not feasible, but now would be the time to foster public debate and to perhaps, do you think it is time that there would be public debate to foster in the officials to actually give utilitarian measures and then to debate certain issues such as who is really vulnerable when it comes to vaccination? Ought we in Malta, for example, have to vaccinated the elderly before actually people who are coming in contact with each other already, like workers, who not only are vulnerable as well, but are also may also transmit the virus? Then some issues like the immunity passports being discussed, etc. So, thinking on a broad aspect within the Council of Europe, and perhaps within the Council of Europe, there's the EU. Do you think that we should actually produce guidelines and directives, respectively, to foster this public debate within countries? And then for the Council of Europe, perhaps, and the EU to actually give some direction on what to do in these circumstances, such as, the locking down of airports immediately rather than waiting for countries to do it themselves, not following the instructions. So that's the question.
Yeah, that's a tough question, but I think you're into something really important, that the importance of coordination between states, which regards travel, of course, and airports and everything, airspace, and also harmonization of rules and regulations. That is really important in a pandemic. I think if you look at the first 6 months of this pandemic, there was a very well, I should say maybe a nation focus in all nations in Europe, really, on how to deal with this. And of course, there was a shortage of personal protective equipment. There were a lot of strains in these countries that made coordination between countries difficult. And then I think it became a lot better when they got into vaccination, and now with vaccination passports, and there are a lot of things that now are being discussed on a wide horizon in Europe. And I think that's good. I think in retrospect, one of the toughest things in a pandemic is how to limit the flow of people across borders, not only goods, but also people, and people have family members everywhere. And there has been a lot of frustration in regards to different regulations. There have been people who were allowed to leave Norway to go to a funeral in France, and they were not allowed to go back because going back was not a meaningful thing, but going to the funeral was a meaningful thing. So there are a lot of examples on how we could benefit from better coordination, harmonization. Still, I think it will be very much the same challenging situation in the next pandemic, because countries will not be hit at the same time. It will develop gradually, and the local and national focus will still be strong, I think, in the initial phase of a new pandemic. But let's hope for better coordination next time, and let's hope that a lot of the learning points are now being codified in regulations and in preparedness plans, at least. And I really do hope that the communication channels now on all levels, both at strategic level and on operational level, that these channels remain open and are accessed when we have our next pandemic or health crisis, because talking to each other across borders is very important in all phases of a pandemic.
Thank you very much, Pierre and Espen. And I wanted to put a question to you, Espen. So you talked about the debate in the early days about the role of children in the spread of the pandemic. And then later you talked about the kind of generational differences in what should happen. I wondered whether there were opportunities built into your public debate systems for young people and children to have their views heard and listened to and to inform the measures that are taken.
That's a very good point, because I think both younger people and also students have not been heard to a great extent really in this pandemic. They have been invited to some debates in media, and there have been discussions, and we have actively involved all kinds of organizations, also for youth and young people, in our work, and at least included them in discussions on a national level with the health authorities. But out in the open, in the general public, I think children and also younger people, students, have been quite invisible. So what we have done during press conferences, for instance, which are twice a week, we have focused on these issues. We have raised our concerns about loneliness among students and other things, and we have pushed universities and student organizations to actually take measures to try to improve things and follow up on students who are vulnerable. So a lot of things have been done, but I agree they have been quite invisible, and I think that goes for all of Europe actually.
Thank you very much, Espen. I'm going to move on to our next speaker, who is Joaquin Rokloff, whose talk is titled Engaging in the COVID-19 Public Debate in Sweden, Reflections on the Roles and Responsibilities of a Researcher. So over to you then.
Thank you, Diane. And I hope you hear me all right. So I'm going to give a very personal perspective. I've been engaged in the public debate as a researcher during the whole pandemic situation. I started doing research on COVID and the virus early, published a few early papers in February. I was pretty up to date on what was going on. So it became natural for me to engage with media, to engage with the public on the latest update, state of the art, and also as an expert commentator in both TV and radio and newspapers and so on. I mean, obviously, I had been engaged before, but not to the same level. The media coverage of the pandemic has been extreme and quite stressful. I was, for example, in an open debate together with our state epidemiologist in Swedish television at prime time in mid-March. We didn't really share the same risk assessment, I think, but it was one of the good engagement opportunities, I think. And I think why did I engage and why do we engage? In Sweden, we have different responsibilities as professors. I'm a professor in epidemiology. I do research, I do teaching, and I do public engagement, and that's what we're supposed to do. The public engagement can take different forms, of course. Sometimes we engage more in stakeholder workshops, in dissemination events of our research. I guess that's the most common. But it could also be debating things and engaging in the public discourse. In the pandemic, there has been quite some engagement from the science community with the public and in media and so on. And a lot of it, I think, has been critique and assessment and questions and so on. But not all of it. It's also been a lot of support and discussions from both ends. it has been polarized, though, so it hasn't been an easy discussion. It's been heated, and I think most people who have engaged in some way have also experienced that this debate and this engagement, this time it's different from before. So I must say it's not only been a very positive experience, and I think I'm not alone feeling that way. It's also been very intensive, as I said. I think in March last year, I was in media about 500 times or so. They cite each other, of course, so it's a little bit less than that. But it creates a lot of pressure also on the scientists, and I'll talk about this soon. But I think there could be ways that the discussion would go in different channels rather than with the media and newspapers and television as sort of a third person, a third body disseminating. It would be better to find other forms for the communication between policymakers and researchers, and the communication with the public from scientists and policymakers. I mean, researchers have an important role in both carrying messages to the public, describing state of the art, I think, and research and the research process and research findings, educating in that sense the public, but also obviously to critically assess policy and critically assess policy making. And that's where I think it has become a little bit heated and difficult debate. The discussion, the tone of discussion has been discussed a lot in Sweden, and I think it's really one of the reasons the public debate hasn't worked out so well. I would say because already from the early phase, there wasn't actually much of a exchange discussion. It was more of pushing away critique from policymakers, which made the discussion climate difficult. And me, among others, who spoke out, were called hobby epidemiologists early on, and I think that really set the tone for the rest of the debate. And since then, it's become quite polarized, and the discussion has been very heated, I would say. And I think one of the things that Espen raised here is the openness of and transparency. To have transparent policy making and assessments or documents where which sort of outline all the critical steps and the uncertainties in the policy making, the unknowns, the knowns, so that could be critically discussed and assessed and supported or criticized. And I think a lot of people in Sweden, researchers engaging, has felt that has been a little bit missing but it's become also much better over time, I'd say. So maybe that was most of it was missing in the beginning, and some of it has actually over time become easier to assess, and to transparency has been better. I think the tone of I mentioned that the state epidemiologist and media actually called researchers who voiced and spoke up criticizing the Swedish strategy, which at least in the beginning was mitigation. We were called hobby epidemiologists, even though a lot of us has been quite experienced and professors in epidemiology and so on. That led to tough debates on the other hand, where people, scientists and professors called the public health agency talentless agency officials. And that obviously sparks the debate. And it is still polarized, I think. I think, as I mentioned a little bit, I think a lesson learned from this is that the public debate in Sweden around the pandemic and the strategy and what we were doing and not, and in addition to having openness and transparency, I think a reason this happened and the polarization was a fact is actually that there was a lack of discussion between the science community and the policymakers directly, and not by a third hand of media and radio and newspapers and so on. And I've seen there seems to be in other countries there seems to be boards or councils which are served with advice to policy making, where the scientific community is represented. Like it could have, for example, have been our Royal Academy of Science, and give independent advice or act as a devil's advocate, for example. Functions like that, I think, would have actually made the situation much more stable, and it would also have been a nicer way to engage with the public, maybe not all of these questions, but actually save some questions for the discussion between scientists and policymakers, and some questions and discussions could then be more public. The Royal Academy of Science in Sweden has had and taken an independent role of making their own independent assessments of things like face masks, for example, which is not just recently been embraced in their public health policy, but it hasn't actually been much built into policy making. It's rather been pushed back, and a little bit like the hobby epidemiologist situation in the early spring. So that's definitely been a weak side of the engagement from the policymakers and official side, at least, and obviously it's led to a response from the science community that I think has not been optimal in an optimal way of engaging with the public and engaging in science debates at all. So we need to do better in the future. Another problem that I see is with these false claims, and it's very difficult to some extent. And the difficulty, I think, here is that Sweden, and that's been discussed a lot, Sweden has, for example, as I said, not embraced face masks. And then there is a big international bodies that embrace face masks, and WHO, for example, CDC, ECDC as well, and Sweden just very recently, and the Public Health Agency and the government has pushed back on that for a very long time. And then on a science basis, we tend to be true to the science, and also it's not necessarily so that as a scientist you see the situation very differently from the WHO or from an international body, and that need to be discussed, of course. And And at the moment, face mask has been embraced for certain situations, first at least, and now more widely. So it's been improving, and there's developments based of the public engagement, but it's been very difficult, I would say. And in this false claims and rumors, some scientists have taken very strongly just the same opinion like the Public Health Agency, and some scientists have taken a quite different position. So I'd say the polarization in the scientific community has also, around these issues, has also grown. I really do think that that we've, both policymakers, everyone who's engaged have had some, it's been good for the discussion, and it's good. It's better to engage and speak out and to criticize and have the discussion rather than to be quiet, I think. I think it's very important with this role of the researchers that it's obviously important that we in the situation we find that there's good reasons to support the governance and the policy making around issues like a pandemic. It's also very important that we keep this independence to and assess the critical, like the scientific reasons for and the background to the different policy, and discuss that. But as I said, I think a lot of those discussions would probably have been better positioned between, for example, the Royal Academy of Science and the Public Health Agency as a sort of advisory role and a second opinion role, rather than open in media. So that's one thing I think could be a good solution for future, and which I think also has been working out a little bit better in other situations in neighboring countries. And I also think it's just as Espen said, I think it's critically important, if you want to remain trusted, that everything can be open and transparent. If we look at trust during the pandemic from policymakers, from scientists, and from medical doctors are top. They're very well trusted, and they are still. Scientists are well trusted, but a little bit less, because of the debate, I guess, and the different, you see how different scientists act, and how different opinions they also could have, opinions or facts on them. And then third, policymakers' trust has been going, it was very high in the beginning in Sweden, and I think a lot of people thought that Sweden would really stand better to the second wave that came in the fall, and when we didn't, the public trust was actually decreased and reduced quite a bit. And then when the second wave was at its top, the public trust was a little bit higher again during these very sensitive times, and then going down a little bit. So it's a difficult situation, and I definitely see opportunities how the public debate and discussions could be improved, and I see also obviously that researchers would benefit from having a better understanding of the public debate, and maybe I think it would have helped in a lot of situations for myself to do a situation analysis, which would be situation analysis on the situation of engagement or in publicly, and a situation analysis on the political sort of situation. So there's many ways this could improve for the next pandemic. I think that's all.
Thank you very much, Joachim. That was really interesting and wide-ranging. I'm going to ask Miguel to put a question to Joachim. Are you there, Miguel?
Yes. Can you hear me?
Okay. Yeah.
So first of all, thank you, Joachim, for your testimony and the many ideas that you've shared. I've actually already had one thing that I would like to ask you before, but now I would probably enhance it a bit, because one of the things that I was interested in knowing is that since Sweden has been kind of like the country that internationally has raised some of the most discussions since it's being pointed out as one of the countries that is leading a different way other than other countries, even though I do think that some of it goes beyond what actually is happening, and there's a lot of hype on it. I would be interested in understanding a bit more a part of what you were addressing, which is to what extent do you think that the discussion that happened, whether by the media or by formal processes of public debates that might happen, in what way do you feel that they've actually influenced the response of the government, whether like changing a perspective or introducing different measures that eventually might not have been considered before? And because of the last part of your sharing, I would also like to ask you a bit in terms of the devaluation of experts, because I think that in a way you were touching on that point. To what extent do you think that public debate, when done in a timely fashion, and in an emergency is always difficult for that, but we're in an emergency that lasts for a year now, so timing starts to be a bit less of an excuse. To what extent do you think that the involvement of true experts and not anyone with an opinion actually also contributed to appropriate public debate? And thank you for your the sharing of your ideas and your work, actually. So thank you.
Yeah, very good question. Thank you. It's interesting to see how it helped or improved or somehow. I think it has. Early on, there were, for example, engagements and debates around transparency and, for example, around the model assessment transparency, that we asked for data and models to be presented openly online directly as fast as possible, and that's been hugely improved, I would say. But not all of it. I mean, I think there has been a lot of things discussed, like asymptomatics or pre-symptomatics period, where you might not have symptoms. That was brought up in March. It was brought up in April. It was brought up over the whole period, but it's still something that has not been, I think, well included in policy making, and it would obviously have large implications. Testing is one of testing, tracing. It has improved, but maybe not as rapidly as you would have wished. The valuing of experts versus non-experts. I mean, obviously, that's a very difficult question, because what I think I think there's been too much focus on epidemiologists like myself in this debate, when it's a society question. It's about economy. It's about behavior. It's about so many things, and it would have been. I think that could also have been functioning better overall. And I think there must be ways to engage people from other sectors to have a nice tone. but still a constructive and critical debate, which is open and transparent around what's actually at stake in each sector, and especially to get people to better understand the trade-offs between doing this and that, which has been critical, I think, in Sweden sticking to some extent still to its policy, and not, for example, going into lockdown and so on. Did I miss anything of your questions there? Or was
No,
that...
I think that in general you've addressed it, and it was a very good reply. At least you got me there.
Cool.
Thank you very much. Can I invite Isunta as well? You had a question, I think, to do with science and policy relationship. You had a question there. Can I invite you to put your question to Joachim? Isunta's gone frozen, I think. Can you hear Isunta?
Oh, I miss the connection for some time. So can you repeat, please?
Yes, I think when we spoke earlier, you had a question around the relationship between science and policy,
Yes.
and the role of scientists. So I wondered if you would want to pose that to Joachim.
Yes, I can. I was interested because in Italy at the beginning there was people were afraid, and at the beginning the information, the daily information from institution was very good. But then, as time went by, began the discussion among expert and not experts people, and among the experts in the media. There were people, general practitioners especially, that were interested about that began to speak about not effective therapies, not approved therapies, and they had a lot of problem. There were a lot of problem to. They make a big confusion among people, because there was a big debate among expert and not expert, and among the experts there were general practitioners or some experts with inverted commas that began to speak about not approved therapies, and so people began to were not more trusted to institutions. But people normally are not familiar with scientific criteria. For example, it's difficult to explain to not expert the criteria of a random study or a peer review. So fake news and uncertainty grow up among people. And this was a big problem. When among experts you have some not really experts that begin to diffuse not exact news, not scientific criteria. For example, hydroxychloroquine. There was a big debate about hydroxychloroquine because some general practitioner began to say, okay, all my patients with hydroxychloroquine, they went good, they did not dead. And this is not a scientific phrase, but the people said, okay, 10 people take hydroxychloroquine, 10 people they did not dead. Hydroxychloroquine is good. This is a scientific phrase for people that are not experts. So it's difficult. And so I have a question: how to improve this situation, to help to people to distinguish among this?
Thank you, Isunta.
Okay.
Well, it's a great question without a very easy answer. I think, well, I think, I mean, one thing could be obviously that that we recognize maybe better the expert from the more, from the non-experts. it's been discussed in different situations in Sweden, whether, can you write a debate on COVID, and can you engage in the discussion on COVID without actually having, and you couldn't just sign off with being a professor. You need to be a professor in the relevant field, and I think that's very, very relevant, and something that the public and it would maybe need to learn something about. Instead of just considering professors as professors, they should consider professors with a very narrow expertise on something, but not something else, perhaps. So that's one thing. On the other hand, I think it's not that simple. I mean, it's a global situation of conspiracies and information that we are exposed to through, not the least, social media, and it hits through. It affects everyone. Our state epidemiologists refer to and in a sense used in a Swedish newspaper. A YouTuber to explain a theory of mortality displacement or harvesting of COVID-related deaths, like people died before because they were so old, instead of people died because of the actual disease. So and that's it's in a sense that's a little bit of the similar situation where which could. I think it affects everyone. It's a general problem that we need to protect us from these ideas. And in a situation of a crisis, it can be tempting to borrow yourself to different ideas, and in the absence of or in the presence of all uncertainties that surrounds the situation.
Thank you very much, Joachim. Thank you. I'm going to move on now to our final speaker, Claudia, who will talk on the benefits of public deliberation. Claudia.
Wonderful. Thanks very much, Diane, and thank you very much to the Council of Europe and the Bioethics Unit and Lee Hubbard in particular for organising this event that we're doing here today. My name is Claudia Chwalisz. I'm leading the OECD's work about innovative citizen participation, which considers the future of democracy more broadly and the paradigm change to a more collaborative, participatory and deliberative governance. So in connection to our topic here today, public debate about COVID-19, I'll be focusing more specifically on citizen involvement in public decision-making about COVID-related questions, and as the kind of title of my talk implies, more specifically about public deliberation. So our work at the OECD is linked to the 2017 recommendation on open government, which recommends adherence to involve citizens and stakeholders in all phases of the policy cycle in ways that are inclusive and allow for informed inputs. This recommendation also emphasizes innovation, so going beyond just traditional consultation mechanisms and experimentation with digital tools. I recently co-authored the OECD Catching the Deliberative Wave report, which has 289 examples of public authorities using deliberative processes like citizens' assemblies and citizens' juries to inform their public decision-making and policy-making processes. So deliberative processes gather people who chosen to reflect a wide cross-section of society. They charge them with providing detailed guidance about complex public policies. Through facilitated discussion, they consider evidence from experts and stakeholders to find common ground and develop informed proposals. So I think maybe you can see how this ties in some of the links to the discussions we were having earlier and some of the points that have been made so far about how do you consider evidence, how do you bring in experts, and so on. But of course, deliberative processes aren't the only innovative form of citizen participation. I would argue they are one of the best, and they're relevant for this discussion about COVID today because of the fact that in this context, the complexity and the trade-offs of the issues at hand are important to consider, and the fact that many issues to do with COVID are not just technical in nature. They're values-driven and moral dilemmas which necessitate and benefit from public deliberation. Like, for instance, even if we just look at the issue of vaccination, questions about who to vaccinate first. Should there be different rules for the vaccinated and the not vaccinated, i.e. All of the discussion about vaccine passports? These are political and moral questions which don't inherently have right or wrong answers to them, but require democratic deliberation to figure out where there's some societal common ground about what we should do about them. We published this OECD report in mid-2020, however, so all of the examples within it are to do with face-to-face deliberation. We know from this analysis that these processes, what these processes require to produce useful recommendations and to gain public trust. They need time, usually many days over many months. They need access to broad and varied information, facilitated discussion and transparency. Successful assemblies take on pressing public issues. They also require politicians' commitment to respond and have mechanisms to ensure their independence. The diversity of people in the room is what delivers the magic of collective intelligence that comes through from this. So there's a great deal of academic research from different fields, from psychology, political science, also business, which shows that having the greater diversity of people involved in a public decision maker sometimes, or often actually usually, leads to better decisions than just consulting with experts who tend to have more homogeneous perspectives, tend to reinforce each other's views instead of bringing up completely different perspectives. So we published the OECD's good practice principles for deliberative processes in 2020, which encapsulate all of these points in greater detail. But of course, COVID-19 has prompted a great deal of experimentation with online deliberative processes. This deliberative wave has continued to build despite the pandemic. Our team has counted over 100 new case studies since the end of 2019 of processes that meet at least 3 criteria, meaning 1, representativeness. So in all of these examples that I'm talking about, participants are randomly selected and then stratified to be broadly representative of the population. Deliberation, this is something that requires time, so there's at least a minimum of 1 full day of deliberation. And impact, meaning there's actually a direct link to public decision making in some way. So far, we know of 19 examples, either finished or ongoing, related to COVID-19 in some way, of deliberative processes related to COVID-19, I should specify. But it's possible and even likely that there are more that we haven't come across yet. What we're seeing is that they're happening at all levels of government and on various types of issues related to COVID. So to give you just a kind of general overview of some of them, for instance, there was a rapid online deliberation on contact tracing apps in the UK. There was the Camden Citizens Assembly on Health and Social Care, which tried to take a bit of a longer term view on the issue. In the United States, the state of Oregon, there was a Citizens Assembly on COVID-19 recovery, focused on a fair and equitable path forward beyond the pandemic, where the recommendations were actually more focused on issues of housing and education, for instance. In the UK, the West Midland Combined Authority had a citizens' jury about COVID-19 recovery, where citizens identified 6 different priorities. These were presented to the Metro Mayor and the leaders of the 7 local authorities. In Canada, in British Columbia, there was a planning cell deliberating trade-offs in COVID-19 policymaking related to design features, data management and uptake of a contact tracing app. In Scotland, there was a panel on the COVID-19 crisis, which was a subset of the Scottish Citizens Assembly about the future of Scotland, which debated the COVID-19 restrictions and strategy in 2021. In terms of processes that are ongoing, there's a Citizens Assembly in Bristol. Brussels has planned a Resilient Day. In France, the Nantes Métropole has a Citizens Convention about the local response to the crisis. In Australia, there's a Citizens Assembly about trade-offs related to using COVID-safe contact tracing technology. In France, there's a Collectif Citoyen on the vaccination strategy of the government. There's a Citizens Advisory Board on COVID-19 in Augsburg, which is renewed every 3 months to discuss local issues that have arisen due to COVID and solutions to them. And there are also citizens forums in Baden-Württemberg and in Thuringia addressing COVID, and one of them is even looking at future pandemics and what can be done to better prepare for them. So a lot happening, and I think probably a lot more might be happening in this space. So over the past year with my team, we've been collecting data about these processes, but we've also been speaking to the practitioners and the policymakers in different countries to better understand the benefits and the challenges of this online deliberative shift, and especially related to these COVID-related questions. Some of the kind of questions or things that we've noticed have come up is that these online discussions might be real-time or asynchronous. Facilitators and participants might be identifiable or anonymous. So these are different kind of design questions to consider. A few things are starting to crystallize in terms of the lessons we've learned. We've noticed that there's been a shift from before the pandemic. What was considered online deliberation was largely individual text-based interactions in an asynchronous format, whereas now we've moved to more and more real-time video calls being the core element of these processes. We've noticed a shift away from an emphasis on just openness in the sense of anybody can participate, in the knowledge that usually when that's the case, there's a rather unrepresentative demographic of people who choose to do so, to one on representativeness and inclusiveness, meaning there are much greater efforts made to select participants to reflect a wide cross-section of society, but to provide them also with the tech and the support needed for them to be able to participate effectively. And we've also noticed a shift away from just individual deliberation to group deliberation, where there is a focus on trying to find some common ground as well. Some have argued that online deliberation is less expensive than in-person processes, but what we've also seen and learned is that the costs are actually quite similar when these processes are designed to be as democratic and inclusive as possible. So what we've seen with this new wave of the online deliberative processes is a much greater attention paid to inclusivity. So for many of the online citizens' assemblies this year, for instance, the ones in Belgium, Canada, and parts of the UK, participants without equipment, such as a computer or a tablet or a smartphone, were given either a computer or a tablet for the duration of the process, along with training and support to use them. And so a digital mediator is also now a kind of new role within digital participation processes for anyone who's really thinking about how can we do this as inclusively as possible. However, I mean, despite this focus and shift to online, I do also just want to stress that virtual meetings don't replace in-person interactions, and that practitioners who have been adapting these assemblies to the virtual world have also issued various warnings to do with online processes having a potential to push people into more linear and binary thinking, because there tends to be a greater use of voting tools rather than seeking a nuanced understanding of other people's reasoning and values. And then also to be open to finding consensus, especially on controversial issues. People need to build trust, which is harder without physical connection, without eye contact. Informal moments over coffee are actually critical for that. They help people to get to know one another. They're important for creating a dynamic in which people are actually willing to find that common ground and say, okay, maybe I don't agree 100%, but I see where you're coming from and I'm willing to accept X or Y. So I think that for the future, we need to be exploring hybrid approaches that include both digital and face-to-face deliberation. And the current learning, experimenting and innovation that we're seeing now will definitely enrich our understanding of the strengths and the weaknesses of each. But when it comes now to the second question that we've been asked to consider about future preparedness for citizen involvement in crisis decision-making, I think there's also many new considerations, and it's a very difficult question also because, I mean, pandemics are not local or national phenomena, but are global in nature. But that being said, I think there's a few things that we can start to consider. And here my remarks will also focus more specifically on citizen involvement in decision-making, particularly through deliberation, though acknowledging that obviously we also need broader public debate in addition to this. So the recommendations that we made in the OECD Deliberative Wave report here, I think, are also pertinent, because being able to initiate a deliberative process quickly in a time of crisis necessitates having the skills and the infrastructure within government to be available and accessible at short notice. So by this, I mean that one of our core recommendations was for governments to invest in having an independent office with responsibilities for citizen participation and deliberation. So this could be, we don't make any specific recommendations on where this should sit or how it should be organised, but the basic premise is more about the fact that within government there should be people who know and can be able to execute a random selection process and the stratification to be able to pull together a broadly representative group of society that has been chosen in a fair way and in a democratic way where everybody has an equal chance of being selected in the first place. An office where there are experts who know how to design such processes in terms of how much time might be needed, how do we choose the experts, etc. And also where there's a pool of trained facilitators on hand that could be contacted even on a shorter notice. And I think having such an office in place has obvious benefits as well beyond crisis situations too, as it means saving time and money by not having to start from scratch each time a process is initiated, and being able to internalize and learn from the learnings that come out of each process. There's another idea that I also came across recently that I think could help facilitate being able to carry out quality deliberation even in crisis situations, which I have to say I take no credit for my own. It was Peter McLeod, who's the principal of Mass LBP in Canada, who suggested it when we were speaking on a panel together last week. And to me, actually, it makes a lot of sense and I think connects to a lot of the ideas we've been exploring at the OECD. So he suggested this idea of service ballots. And Mass LBP defines these as a mechanism to give voters a simple and an effective way to volunteer their time to serve on a public board, agency or commission, and to provide their advice to government on a specific issue. So offering voters a service ballot can dramatically increase the number of candidates available to fill these roles and improve the diversity of public governance. So what it means in practice is that when people go to vote at the next election, in addition to their voting ballot for the party or politician they're voting for, there's a second ballot that would allow them to tick off for which types of issues they'd be willing to volunteer their time on a citizens panel, for instance. So that in a time of crisis or if an issue arises related to that, this would dramatically reduce the amount of time needed to actually carry out a proper recruitment process and could get the panel going much quicker than if you're just starting from scratch at the time of when the process is needed. And then finally, the last point I'll make is that I think we can take into account the learnings from the various transnational deliberations that have taken place for better public debate also at the global and the European levels. So for instance, just a few months ago, we saw the Citizens Dialogue that was organised by the European Commission and the Bertelsmann Stiftung, which had 100 randomly selected people, broadly representative from 5 countries, speaking 5 different languages, for 3 days about the Green New Deal. I think it shows how it's possible to do multi-country, multilingual deliberation about complex policy issues. There's also the Global Citizens Assembly about genome editing that's taking place in 2021 to 2022. And there's also a Global Citizens Assembly being organised in connection to COP26. So I think there'll be many lessons that are learned from these experiences that are happening as well. So these are my three main points regarding the future: investing in participation and deliberation infrastructure, experimenting the idea of service ballots, and employing the lessons of transnational deliberation. But I think that this question definitely merits some further considerations and is also something that we're reflecting on at the OECD, and I'm looking forward to hearing what the other suggestions and ideas that come up in the discussions about this today. So I'll leave it there, and thanks very much.
Thank you very much, Claudia. And you very nicely turned us towards thinking about the future and what we need to consider for dealing with any future crises, which may be health crises or potentially other crises. So I'm going to ask Nika, do you have a question for Claudia?
Thank you, Diane. Good afternoon, everyone. I'm Nika. I represent here Advisory Council on Youth of the Council of Europe. Thank you very much to the speakers for giving us so much food for thought. And thank you, Claudia, for this very interesting mapping of the innovative practices and as well comprehensive analysis. I would like to ask you two questions, actually. The first one is about participation. Public debate on biomedicine, especially during COVID times, especially now, have proven to be very crucial. How should we ensure the participation of different segments of the society, especially the vulnerable groups, or for example, young people? And to what extent do you think they should participate in decision-making processes? And then the second question is that COVID-19 pandemic response have brought different vulnerable and minority groups into the public attention, and frequently in a negative way, which has caused waves of hate speech on the social media. How should the authorities ensure that the hate speech does not augment already acute social background? Thank you very much.
Great, thank you, Nika. Both very, very good questions. So I'll start with the first one about I suppose, ensuring the diversity of people who are participating, ensuring that we are hearing from all segments of society. And I think this is a particularly important consideration when we're talking about an issue that affects everybody. And I think that oftentimes, and I think a more traditional approach has been a very segmented approach, like let's hear from youth about this, or let's hear from certain stakeholders, or so on. And this is also one of the reasons why I put such an emphasis on deliberative processes in my presentation, because I think the use of random selection to bring people in to these processes is becoming more and more common. I mean, we're seeing it in the data, actually, that the use of this has really exploded in the past few years, and I think will only become more commonplace. And I think that's for a few reasons. We're seeing that, first of all, when people receive an invitation, if it's from, a minister, a mayor, someone with authority that arrives in their door and invites them to participate in such a process where it's explained how their time and how their inputs are actually going to affect decision making, then we see that the people who usually don't show up to town hall meetings, who don't participate in online consultations, so who don't even vote oftentimes, are willing to actually give up the time and to make an effort and to participate in such processes. So we are definitely seeing more diversity in terms of who's coming in the door. The emphasis on stratifying to ensure a broadly representative group of people also ensures that that there's young people, that there's older people. I mentioned some of the efforts that are being made to break down barriers to participation, especially in times of COVID. I was speaking to a practitioner yesterday who was telling me that in one of the processes, there was an 83-year-old selected who's never used a computer before. And so they are going to go to his place and bring a computer, and someone will sit with him the whole time and help him to use it so that he can actually participate in this deliberation. So I think we're seeing more and more of such efforts to actually, bring the young people and the older people into the same conversations together, and we need to I don't think we should lose sight of really the benefits of this, because here I think when the challenge is not just about what do young people think, or what do older people think, or what do X, Y, or Z think, it's not just about aggregating individual opinions. We want to be able to get a sense of collectively where can we find some common ground on these tricky decisions that we need to take, and that's also where I think the benefit of such processes comes in. On the second question about hate speech, I'm not sure I fully grasped what you were getting at with the end of your question. Would you mind just repeating it or rewording it slightly?
Sure, no problem. I was asking whether, what should be the role of the authorities to prevent hate speech arising in this kind of critical moments, like pandemic was in the early days, even today, when groups were especially targeted by hate speech and misinformation.
Right, okay. I'm not sure I have the answers to that in particular. This is less specifically my area of expertise, but again, I actually think that's one of those topics that even having some public deliberation on it could be very useful. Actually, in Finland, just 3 weekends ago, there was an online citizens panel that took place about how can we tackle hate speech. And it was more specific about hate speech targeted at public figures. And the panel gave, I think, 19 recommendations to the Finnish government about different things that they could be doing. It's not public yet. That will be released shortly, though. But, you know, I think that these are the sorts of problems that affect society. They don't just have right or technical solutions. And actually, I think to do with hate speech, there's a really fine line between, you know, protecting people's freedom of speech, but then also protecting other people from harm. And so again, I think this delves into that murkier realm of moral questions about how do we deal with this, and is also a particularly like well-suited topic, I think, to having public debate and deliberation about it.
Thank you very much, Claudia and Nika. I have a question for you, Claudia, as well. So a lot of the places that you mentioned in your kind of list of people who are carrying out COVID-19 engagement, so Camden, Oregon, British Columbia, Scotland, Australia, France, have a tradition of engaging their citizens anyway. They have a history behind it. To what extent are you seeing new countries, locations, areas coming into these conversations as a result of COVID-19, or are they all people who have an established history of this kind of engagement?
It's a good question as well. I would say I've more of a hypothesis than anything. I've actually delved into the data to know about this. But I mean, I think you're right to point out that we've seen the places that have the strongest traditions already of participation and deliberation are also taking those routes now. But I do also have to recognize that I think in our data collection so far, we also have a bias in terms of both language and also accessibility to finding out about cases where we're within the OECD best connected, so within OECD countries. And so we are making an effort in particular right now to try and reach out to our broader network. We have an OECD Innovative Citizen Participation Network, but also the OECD's Working Party on Open Government to try and collect and find out more information about what's happening kind of beyond our initial sphere of easily accessible information. Because, I mean, we also found that even for the general report that we published last year, you know, we found out about a whole bunch of cases in Japan, for instance, that nothing had been written about them in English. And it was only thanks to someone in our network who could translate and provide us information about 15, you know, very relevant and interesting case studies. And so we're trying to do a little bit the same work now, because I'm sure there might be some things happening in countries where perhaps just to our English-speaking world, we haven't heard too much about it yet. So we'll see.
Thank you very much, Claudia. So just first of all, thank you very much to our three speakers for really kind of rich and thoughtful presentations, and to our respondents. Don't go away, we'll come back to you. So I just wanted to, my kind of takeaway, the things I heard. So there's something about the relationship between science and policy, and then the science and policy and public conversation, which has been threaded through the presentations, and to do with the nature of expertise as well, both in terms of expertise and non-expertise, but also people with an expertise speaking outside of the area of their expertise. The role of transparency and openness in building trust, which made me think about the extent to which if you don't have a history of openness and transparency, is during a pandemic the time to start introducing it? Or actually, what's the relationship between the levels of trust in people's actions during a pandemic and prior levels of trust, and the kind of cultural dimensions of that? There's something about harmonisation and cooperation across borders as well. This is a global pandemic. Claudia's just pointed to things happening elsewhere. So there's a lot to sort out there, how we harmonise and cooperate across borders, both in managing pandemics, but also in understanding what public debates are going on where, and how we learn from each other. Fake news we've sort of talked a little bit about fake news and false experts, people pretending to have expertise, and also hate speech being a particular problem, and the combative nature that can come out in debates between people with different perspectives on a topic. And also, finally, the breadth of expertise. This is not just a technical issue, as Claudia's pointed out, and Joachim also talked about. This is about social, behavioural, emotional, values-driven perspectives within which the kind of technical and medical response to the pandemic needs to sit. It cannot be separated from those questions. So with that in mind, I'm just going to, first of all, ask the respondents to focus on next time. I think we were all agreed there will be a next time at some point, and preparedness, and making sure that we start to put things in place so that we are much better able to respond next time. And I'm going to pose some of the questions that are coming through on the chat. One of them is a really interesting and difficult question. I'm not sure that I could answer this one. Could there be a good public debate based on poor science? So I'm going to come into Joachim. Going to put you on the spot with.
Yeah, I mean, depends on what you mean with poor science. There's a lot of poor science all the time. I think part of the responsibility and the exchange between different people in this debate around COVID has been trying to separate the good pieces from the bad ones, and also emphasize uncertainties. Of course, there was no evidence base for SARS-CoV-2 virus. We didn't know, and that's obviously challenging because at least like in Sweden, we're used to having long periods of assessing evidence base and pretty slow decision making. So it's definitely a situation where we need to discuss, and there need to be. I think it would probably benefit from that, scientific advice functions that some countries seem to have between policymakers and scientific advice, because it's more difficult when the evidence is poorer. So there would be more reason to ask for extra opinions, and the normal ways of scientific judgments and scientific evidence judgments would not necessarily apply.
Joachim, thank you. Espen, have you got anything to add here?
Yeah, I think it's a very interesting question, because I think in a health crisis or in a pandemic, there will not be evidence publications that can give answers. Research takes time, and you need to make decisions based on what you have. And I think our perspective has been to include all different specialties, not only within epidemiology, but in infectious diseases, anesthesiology, intensive care, all these aspects of medicine at least, and also non-medical experts on crisis management, because you need to build all this together. And those who believe that you can manage a crisis only based on published evidence, I mean, that's impossible in a pandemic. Just think back 12 months. What did we know about this virus? I mean, almost nothing. So that's what makes this a bit difficult, because if you broaden your perspective, you're more likely to have the same level of understanding of the situation, and you get input from all these experts that's prove valuable when you connect them. So I think it's a very good question. But when it comes to the future and what we can actually learn from this crisis, then everything that's published is, of course, of very high value when we prepare for the next health crisis. So I really hope that we will see a lot of publications now in the next year on the management of this crisis and all the details, all the broad aspects. I think that can take us a leap forward, really, in terms of future preparedness.
Thank you very much, Espen. We have another question that has come through to both Espen and Joachim, but I think it may be useful to hear Claudia's perspectives on this as well. Do you think public media has managed to stay neutral and convey the scientific messages, or have they fueled the polarization between experts? Do you think the debate climate, including discussions on social media, has changed during the past year? So can I start with Claudia on that one?
Putting me on the spot when I was not anticipating that. No, but it's no, that's fine. That's fine. Again, this strays away from my main area of expertise, but I mean, I don't know. I had a chat with our colleague to focus a lot on public communication and disinformation and misinformation before this seminar, just to be a bit more in the loop, because that's their main bread and butter of what they're working on. And I think that's one of those questions that it depends on the country. There's been very different approaches taken to this. I think there's a different media environment in different places too, and so I'm sure that people are not very excited by an "it depends" answer. But again, I think this is why we need to have more rigorously organized public deliberations on these sorts of questions, because what we found, for instance, taking examples of some of the really high profile deliberative processes that took place on controversial, important societal issues in other countries, not related with COVID, but what we can draw lessons from. So if we think about the big citizens' assembly that took place in Ireland about different constitutional questions, including the question of abortion, the fact that they live streamed all of the experts' presentations, that there were around 100,000 people that watched those live streams, that the media was briefed before and after every single meeting, that they, were also relaying and conveying the expertise that was presented to the citizens panel during those deliberations. I think those are things that we are just not really seeing happening in this context, which I think having more public deliberations where there's also that media environment around them could be part of the solution in some ways.
That's really
but I'm sure Joachim and Espen have some other views from their countries about this.
So it is really useful, because you're pointing us towards the future and what we can learn from what we know already, which is really helpful. So Espen, I'll come to you first.
Well, thank you. I think, at least in social media, I think this has been the debate has been more fierce in recent months. I think that goes for all of Europe. You can clearly see much more polarized debates now than it did in March and April, although it also started in the spring of 2020, just after the first wave of the pandemic. But I think it's really important, because I have a Swedish wife, so I follow Swedish media on a regular basis, and I will be a little bit careful now with how I say this, but I've been quite surprised, not about what has been discussed, but about what has not been discussed in media in other countries. That's been quite shocking, because we have reached some of the same milestones, and in Norway at least, that has triggered a lot of debate. Whereas when I look around, not only Sweden but other countries as well, also outside the Nordic countries, it's amazing how little attention some of these really key milestones have had, and it's also strange to see that things that are heavily discussed maybe in March or April in one country then end up being discussed in another country 6 months later. But it's the same topic and it's the same discussion. So, but I think the general tendency is that the proportionality of these of the measures now, and should they be lifted? Should we reopen society? When should we, so to speak, reopen everything? All these things are being debated all over Europe right now, and it's a much more emotional debate now because people are so fed up. Whereas in the first 6 months of the pandemic, there was very little debate about these things. That's my take on it, at least.
Thank you, Espen. And Joachim?
Yeah, it's interesting, Espen, that you mentioned Sweden. I just read something from the Norwegian state epidemiologist Forland, who which I think is pretty much it says quite a lot about the Swedish media coverage about the pandemic in the Swedish situation. As he said, the Swedish journalist asked him a question over the pandemic, which was all the time trying to confirm that Sweden was doing the right thing. And there's been so much comparisons between Sweden and Norway, I think, and I think that's how it's been. It's been quite. Some things has been discussed a lot, and some things has not been discussed, as was mentioned as well. So I would say that there's probably been such tendencies. In social media, it's more difficult, I would say, because it's not to the same extent respecting national borders. It's more international, and there's more exchange between international tweeters or whatever it is and national. So it's more, but social media is well known to create bubbles. So I'm sure there's a lot of those as well, and it's also very difficult to recognize when you're in one yourself. Shortly. You're muted, I think.
Sorry? Can you hear me? Yeah. A question from Miguel. Do you want to pose your questions, Miguel?
Yes, actually, it relates, I think, a bit with Espen was mentioning, but I think that deals to all. I failed to mention before that I'm here on behalf of the Conference of INGOs, the entity that connects all the different INGOs in participatory status with the Council of Europe, and I'm I take the responsibility of being the vice chair as a committee on human rights, and so I would like to make a human rights question to all on this, which is, to what degree have we been aware of human rights when addressing all the strategies that were set in place in the different countries? And I ask this in having in mind the Article 3 of the Oviedo Convention, where we have a specific mention to equitable access to healthcare, which in cases of pandemics, the part of access to healthcare might be very constrained, and I think that it's something relevant to have in mind. In terms of Sweden, I would like to perhaps know a bit more. How was the right to previously expressed wishes, having in mind that they considered that probably they would try to use a natural immune response of the population, so there would be in some way a foreseen risk in terms of mortality. And then on the European Social Charter, I find it very interesting that one of the topics on the right of protection of health, it specifically mentioned that parties have the duty to prevent, as far as possible, epidemic, endemic, and other diseases, as well as accidents. So to a certain degree, we've failed the population on this right. So how do you see that? Since we've mentioned and we continue on discussion human rights in several fronts, how can these be more of a guide for future experiences when that will surely come up in the near future. And if you allow me a second question, but this one is simpler, which is also for the future. We've discussed slightly on in terms of experts and so on. A lot of governments already have formal bodies of consultation. I think, for example, of ethics committees. But because of COVID, we're seeing a bit of across Europe the creation of ad hoc groups that are supporting the government. So what would be your take on these formal bodies? Because if they are not being used right now, then weren't they probably constituted in the beginning with enough diversity for the purpose, or should they be more used? It's a question I think that we'll deal for all. And thank you once again.
Thank you, Miguel. Can I go to Espen first on that?
Well, at least I can comment on part of it. I think it's a very good question. I mean, human rights and the right to healthcare, the right to be protected against illness, and that's an important element that probably hasn't really been discussed in a human rights perspective in this pandemic. Really, it's been all about measures to sort of limit the burden on the healthcare system and also on people's right to travel, to gather, to drink beer in bars. I mean, all these things have been raised in the human rights debate, but really the right to be protected and to have access to healthcare even during a pandemic has not really been debated. I mean, I guess we all take it for granted, and in my perspective, I mean, the reason why we've done all we've done to manage the pandemic is to not only make sure that people with COVID-19 get the best possible treatment and actually survive, but it's more actually about all the other patients who need healthcare on a daily basis and who suffer from an overwhelmed healthcare system. That's really the key. If that capacity is overstretched manifold, then of course that has impact on the society as a whole. And the diverse scenarios mean that there are kids who lose their grandparents, there are even parents who die from this. I mean, so it's all the discussion about the total burden of a pandemic on the nation, really. That's also a human rights perspective. But I think it's a very good question, because this has not really been debated on a level like that so far, at least not in our country, but it's a very important debate and discussion to have, at least as we exit this pandemic, I think, in terms of future health crisis.
Thank you, Espen. I'm going to ask the speakers to be very brief in their responses to the next questions. We had one that came in from France prior to the webinar, and they asked about reconciling generations in public debate. Are there things that we might do? I'm going to come to Claudia here to make sure that the different perspectives, Joachim highlighted these earlier on in his presentation. How do we reconcile different perspectives and different impacts on different generations?
Yeah, it's a good question, and I feel like I'm going to start sounding like a broken record soon. But it's again to my point that I was making earlier, or trying to make earlier, at least, about why it's so important to have processes that try to bring together that wide cross-section of society. Like, I think that a lot of times most public consultations, most forms of engagement are still designed in such a way where there's rather that aggregation of individual views, and a lot of traditional consultations, when they're open, we have a lot of research which shows that it tends to be certain demographics that disproportionately participate. So you hear from people who are more well off, well educated, people who are white, who are who are wealthy, who live in more urban areas, and you're not hearing from a whole subsection of voices. So I think these are really design questions which sound kind of boring and technical to think about, but which have big normative implications about who we're hearing from and then what kind of decisions we're taking off the back of that. And I think we need to have more forms of initiative where we bring together different groups, we bring together younger and older generations, but around the same table and with an aim of them finding some consensus and some common ground about, where can we agree? Because I think that's still not happening that often.
Thank you, Claudia. I think we've probably got time for one final question from the chat boxes. So there's a representative from the Netherlands who's asking, it's to do with the involvement of protesters. How, when do you involve protesters in these public debates? And the question says, knowing they will not listen. And how are they coping with the situation? How are states coping with the situation of the protests, which you could argue are one of the forms of public debate? Joachim, I'll go to you.
Yeah, that's an interesting thing. I think, one way to deal with it is to have a discussion going, a debate going, which is more reasonable, maybe, and more, both ways, or whichever ways it takes, public, policymakers, scientists, other people, so the protest situation doesn't dominate, but there is actually other things going on, which is maybe has more content that people could be distracted by. There would be one way, but I must say that really not my area of expertise. I'll probably hand it over to someone else. You're muted, Diane.
Thank you, Joachim. So I think we've probably come to the end of the questions that we can take from the chat, but I wanted just in the last few minutes to pose the same question to everybody here, respondents and speakers. So I'm going to start with respondents. So what the question is, what practical steps do we need to take to ensure that wide and inclusive public debate is integrated into rapid decision-making processes, recognising that we need to move quickly. We haven't got the leisure to take our time, so that human rights are respected in future crises. So that's quite a big question. Nika, I'm going to come to you first.
Thank you, Diane. Well, I think human rights should always come first. And this pandemic has shown us that there's not enough know-how how different segments of the states or public acts in this situation, and how do they secure the participation of every social group, including vulnerable groups. I think maybe a task for intergovernmental organizations for the Council of Europe would be to actually create this kind of know-how. I know that there's some which already exist, but to go beyond and go further in this matter. And I think as far as I'm concerned, I think the accountability, participation, and transparency is one of the major matters that should be upheld during this process, including also giving the diverse pathways of participation towards the diverse society so that everybody can participate.
Thank you very much, Nika. Can I come now to Assunta?
Yes, thank you. I think that it's necessary to individuate real experts. Also, I agree with Espen, not only medical experts, but real experts, each one in its field, to involve, to engage, and to do a sort of bridge between policymakers and common citizens. And I think that it's important that they are able to explain scientific criteria. There are scientific criteria also for sociologists, there are rigorous criteria also not for strictly scientific topics, but rigorous and logical to learn together with the citizen what is logical, what is reasonable, and what is not true. So real expert, also in not medical fields, but real expert, each expert in its field, and able to explain rigorous criteria, scientific criteria, for people that are not expert. This can avoid fake news and uncertainty among people, to my opinion.
Thank you very much, Assunta. And Pierre, I think Pierre might have left us. So I will come on to Miguel.
Yes, thank you. Great question. I think it comes to the title a bit of it in terms of preparedness, and the guide on public debate from the Commission specifically mentions the need to take it before a decision is made or before it is necessary to do something. And a lot of the things that we are here discussing, we already knew that we would need to discuss them beforehand. Bill Gates comes to mind, where he's been advocating for proper preparedness for pandemics for years now. So there's a lot of the things that we are now discussing that we should have already been discussing beforehand and being prepared for that. And even within this pandemic, hats off to the DHBio, because now we're discussing in terms of government the immunity passports. Well, I remember that there was at least one session within, I think, a webinar of DHBio in June last year, I think, when this topic was already mentioned. So I think that the discussion on topics before we have to take decisions on them is the best way to prepare in advance and to have proper consideration for all the relevant matters in terms of inclusions and on human rights, of course. And so that's, I think that's discussed in advance and do first things first. We have to discuss the important things first. I think that's the key issue. Okay,
thank you very much. We've got 4 minutes, so I'm going to, because I want to give Ritva a chance to come in and say thank you. So Espen, Joachim and Claudia, less than a minute each.
Well, yeah, I think it's okay. I think it's hard to sum up everything. It's been a good discussion. I think it's given a lot of food for thought, at least for my part, because I've heard very interesting aspects that I really haven't considered that much before this meeting. And also, I think, especially the human rights perspective, how to use different experts to sort of broaden the perspective early in a health crisis, and also to think about different elements of human rights within crisis management. I think that's important to still take note of, because in crisis like this, we all fall into technicalities, and we sort of evolve ourselves within bubbles, and we can't really see anything but the forest in front of us. So I think that's an important perspective to have. So thank you for a very good meeting.
Thank you, Espen. And then Claudia, just 30 seconds.
Sorry, did you want me to come in next?
Yeah.
Oh, okay. Sorry, you're mixing up the order. Yeah, no, I mean, one of those impossible tasks to sum up in a minute at the end of what has been such a rich discussion. But I think I'll repeat the point I made about the importance, I think, of investing in the skills and infrastructure within government to be able to execute participation and deliberation, so that there's not a need to start from scratch when a crisis arises, but there's actually already that foundation there that can be relied upon, that to reduce the costs and to be able to make things happen quickly. So facilitation skills, the recruitment skills, etc. And I think beyond that, just the more general considerations about how do we institutionalize public deliberation to be a more normal part of our public decision making more broadly. So considerations, for instance, like in France, there's the 2011 law on bioethics, which necessitates a fairly extensive form of public deliberation before any new changes or new laws on bioethics can be voted upon. I think, considerations of that type of legislation related to public deliberation about pandemics is something that we can and should be thinking about, or about crisis situations a little bit more broadly, as well as the discussions we're having with different member countries right now about how do you even create permanent structures where randomly selected citizens have a role to play in connection to other democratic institutions, so either feeding into the parliaments or feeding into parliamentary committees, etc. So we're seeing this happening, like for instance with the Brussels Region Parliament mixed deliberative committee involved. I'll leave it there.
Thanks, Claudia. And Joachim, you have definitely only 30 seconds.
I'll be very short. No, very interesting. Lots of lessons learned, I think. Open transparency, the importance of thinking this through before the next situation arises, crisis, and considering this bioethics and human rights aspect is very important. And using scientists in a way, but still, I think it's also critical. I have to talk to the scientists again. I think it's also critical, important for the citizens and for everyone that it's clear that when scientists talk, it's also an independent voice. It's not someone who's talking for someone else. Otherwise, you lose your trust. So we have to build systems for that, frameworks.
Excellent place to finish the webinar, Joachim. Thank you very much. I'm going to invite Ritva to come in and just say a couple of closing words because we're right on the deadline now. Ritva.
Yes, I wish warmly thank you all for your excellent thought-evoking presentations, and also many thanks to respondents, and many thanks to you, Diana, also for moderating this webinar, and also you that made comments and questions to that chat box. I'm very glad that presentations highlighted the importance of open-mindedness and honesty, and also importance of evidence-based information in understandable form to structure the discussion and how to make good and structural basis for constructive public debate. It's clear that we need more structured dialogue between different stakeholders and population groups to participate in the dialogue, and thus to create and maintain more equal, healthy and more well-being societies. Ethical dialogue takes place between individuals, not top-down, from the decision makers to the crowd. Inclusion lies at the cruise. The more citizens are taken to participate and involve, especially those in vulnerable situations, the better. COVID-19 pandemic has demonstrated that where there is a greater risk and uncertainty, there is greater need for public debate. Anticipating and being prepared is therefore of critical importance. Thank you very much for all of you. Thank you.
Thank you, Ritva, and thank you to everybody. We're 2 minutes over time. Apologies for that, but it's been fascinating. Thank you very much.